We are here in Berlin, and we have with us Dr. Ahrens, who is going to speak to us about her recent study. Good morning, Dr. Ahrens. Would you like to give us some information regarding your rationale and aim of your study?
As you know, an atopic career often starts in early infancy with the first manifestation of an atopic dermatitis, and many of these children are also sensitized against food or airborne allergens. And in this context, as you know, the hypothesis came up that allergens might be absorbed through an ineffective epithelial barrier and promote allergic sensitization. And at the end of this sensitization process, you can detect, for instance, specific IgE. And we now wanted to look for further players in this allergic inflammation process, and therefore we chose certain chemokines, as chemokines are largely involved in the pathogenesis of allergic diseases. So the aim of our study was to analyze whether in a cohort of infants these chemokines differ, and we measured serum levels, differ in a cohort of infants who suffered from atopic dermatitis with or without sensitization against food or airborne allergens.
Okay, thank you. And which are your main findings in this study?
Well, first we focused on TARC, CCL17, because in the past it has been shown that TARC correlates with the disease severity in patients suffering from atopic dermatitis. And our data now demonstrate that this correlation between a high score, so a strong inflammation, and CCL17 is even more pronounced in infants who are also sensitized against food or airborne allergens. And of course, this is something we somehow expected because it fits to the hypothesis I briefly mentioned above. Even more interesting in our study was that we found in infants with atopic dermatitis who were sensitized against food allergens that these infants had higher levels of CCL25. And CCL25 and its ligand CCR9, or CCL25 is a ligand for CCR9, is localized primarily in the gastrointestinal tract and is discussed as being involved in T-cell chemotaxis to the gut. And of course, this is very interesting, having this connection, food allergy or food sensitization and the gastrointestinal tract.
So, from your study, we can understand that CCL17 is a marker of airway of airborne allergen sensitization, and CCL25 of food allergy sensitization in children with atopic dermatitis. However, not all children with food allergy sensitization develop food allergy eventually. Could you think from your preliminary results or from maybe unpublished data a marker or some future aspects of your study that could help us more specifically identify this subgroup of patients with food allergy?
I would put it a bit different.
Yes,
so in regard of CCL17, our results emphasize or highlight a link between skin inflammation, barrier dysfunction, and the sensitization process. And in regard of CCL25, we found that food-sensitized infants had higher levels of CCL25. But our data didn't give us any information about the predictive value or about any predictive capacities for an individual. But nevertheless, it strongly indicates an impact of these axes, CCL25, CCR9, in the context of a food-induced inflammation process. But of course, we want to address exactly this question, the role of this axis, CCL25, CCR9, and its predictive potential for food allergy in future studies, but so far we didn't have any data on that.
We can understand that CCL17 and CCL25 play a significant role in the maturation of T-cell in thymus. And we also see from your study results that those chemokines may serve as markers of allergy sensitization of children with atopic dermatitis. So do you think that there is any possibility to use these markers for early diagnosis or even treatment in children?
This is, of course, a very interesting issue, where the expression of CCR9 and others have been described as being required for the induction of oral immune tolerance in mice. So consequently, it is important and interesting to look whether CCL25 differs between tolerant and allergic sensitized children. Mm-hmm. So far, unfortunately, we cannot determine whether CCL25 is connected to food allergy and or only to food sensitization. Another interesting possibility is that CCL25 might be linked to an early intestinal barrier dysfunction in context of an early allergen contact, for instance, so that it could function as an early predictor for the development of food allergy. But we have to address these questions, of course, before we can make any future implementations.
Thank you. We're looking forward to see more results from you. Thank you very much.
Thanks.
Have a nice day.